was formerly a professor of botany at University Science Malaysia. He retired from this position after teaching and research at the university for 26 years. He has written numerous research papers and more than a dozen books. He was a fellow of the Matsume International Foundation, fellow of the Alexander von Humboldt Foundation, and also was a consultant to UNEP's Bhutan government. He is going to speak to us today on lung cancer, some success stories with cancer care therapy. Dr. Chris Teo.
Thank you very much, the organizers. It's indeed a privilege to be here. I thought I'd never make it, but I'm glad I make it. I was invited to come give a talk. But unfortunately, I'm going to shut up and I don't want to talk. So I will ask you to listen to the patient talking and I will just keep quiet. So that is how we are going to do the talk today. Well, they saw there's a mass in the lung.
Yes.
So what they want you to do?
They want me to do a biopsy.
You agree to the biopsy?
No, I ran away.
Oh, you ran away.
And so I said to him, why would I want a biopsy? What is that going to show?
Yeah.
Oh, then we can give it a name. I said, well, it's already got a name.
Yeah.
You know, it's called cancer. No, we don't say that word. We don't say that word. Even in the diagnosis, they only put CA.
Yeah.
They don't print that word.
Oh, the cancer, see, the CA is cancer. I mean, who don't know that? Cancer is cancer. I mean, there's nothing to argue about it. What else do they want you to do?
They want me to take chemotherapy and radiation and some medication, which costs about 7,000 ringgit a month.
Medication, which they call as Irisa, that you take every day.
Yes.
Yes, and then that will cost you 7,000 per month.
I tell them I don't want surgery, I don't want chemo, and I don't want radiation, and I don't want your medication.
Yeah.
He says to me, he closes the file and says, you've got 3 months to live probably, but I respect your decision.
So he was pretty upset with you?
Yes.
Yeah, he shut down and said, well, you got 3 months to live, to frighten you. So you are right. Going to do chemotherapy, radiotherapy, taking Irisa that they're going to give you, it's going to waste a lot of money, going to mess you up, but it's not going to cure you.
No.
Yes.
Okay? Yeah. It may shrink the tumor, make you happy for 2 weeks, and then it will come back again.
Sure.
Lung cancer can go to the bone.
Yes.
So we do not know whether this is due to bone cancer or not.
Yes.
Well, to know whether it is, of course the bone scan will show you whether you have it or not. But on the other hand, even if it is a bone cancer, what can you do? There's nothing they can do except to radiate you. The herb that we give you is going to be bitter and smelly.
I don't
terrible,
care.
terrible.
Yes.
Okay, it's not nice, pleasant to take. But it is good for lung cancer. Lung cancer is possibly a number 2 or number 3 problem we have.
Yes.
Breast cancer,
Because doctors
lung
can't do
cancer,
anything
liver
about
cancer,
it.
colon cancer, these are the things, and liver cancer, these 5 sort of. But I cannot cure.
No, sure.
That you have to understand.
Yes.
Because nobody can ever cure any cancer. So there's no cure. Only thing is you have to take care of yourself. That's all I can ask you. They will teach you about your food so that you avoid things that are good for cancer. You don't want to feed your cancer. I have a list of things. In fact, I've written so many books on how to, my wife has a cookbook and all that tell you everything about food. You take care of your diet, get rid of your pain,
Yes.
and you can live a happy life. So be it. One of the day you decide that you don't want to live, just jump into the sea and that's it.
Exactly.
That's
exactly.
it. You know?
And that's what I say. Well, that's basically my philosophy.
I just ask you to stop and think. 3 months to live just because you don't want to live to do what the doctors want you to do. I think it sounds like a bad joke, and I will tell you why. If you read this book, Cynthia Foster, what is she said? She's a medical doctor. She said there are plenty of statistics to show that people die sooner if they follow the doctor's advice and have all the cancer treatment than if they just do nothing. Please don't get angry with me. I'm not fighting with the doctors, but this a doctor saying that. All right. If you read further a bit, doing nothing involves not bankrupting themselves with expensive treatments, not being subjected to medical mistakes and horrible complications, not suffering from dangerous drug toxicity and interactions. That is what she said.